Welcome back to APP 2015. I'm talking to Paul Jones, the owner of Moodies Pharmacy in Bathurst, New South Wales, and Paul and his pharmacy were the winners of the Innovation in Professional Services Award at the Pharmacy of the Year Awards. Congratulations, Paul.
Thank you.
What's the award mean for you and your team?
The award means that it's recognition for all the hard work that we do providing services to our patients. We obviously did a shop fit just over 2 years ago, built 2 consultation rooms, which we call Easy Clinic rooms, and by doing that we've been able to deliver a whole range of services to our community.
And just for people who may not be aware of Bathurst, just describe the town and the area that you service.
So Bathurst is a smaller regional city in the central west of New South Wales. We're just over 200 kilometres from Sydney. There's about 35,000 people in Bathurst with 7 pharmacies. There's quite a big uni student population. I think there's nearly 6,000 uni students there, and most people know Bathurst for Mount Panorama and the V8 supercars racing around there. So yeah, Bathurst is a great community, and it's got all the services you need.
And what sort of professional services do you offer in the pharmacy?
We offer a number of professional services in the pharmacy. We do anything from blood pressures to blood glucose to carbon monoxide readings for quit smoking. We do sleep apnea, we do weight loss with a CSIRO Imprimi. We do a small amount of compounding. We use our consult rooms all the time. We also do drug and alcohol program, which is some people might know as methadone or Suboxone. So we do a lot of services.
So quite a few different programs, yeah.
Yeah, we do.
Are there any in particular that you're proud of?
I'm proud of all of them. Personally, I don't do them all. We've got a team of 4, sometimes 5 pharmacists that work there over the week because we're open 70 hours a week. The ones I'm probably most proud of is the sleep apnea, the weight loss, and just the diabetes and the blood pressure ones. They're the ones that we do all the time, every day. All the pharmacists can do them, and they're really trying to help people with chronic diseases.
And is the aim with those to make yourselves the regional hub for servicing those, like say sleep apnea for instance? Or?
Yeah, the sleep apnea one's a challenge, and that's why I'm very proud of it, is because we compete against a business, a standalone business that does sleep apnea, and we're still able to grow that business and do that even though we compete against someone else who's out there as a standalone business.
And at your acceptance speech you mentioned the Easy Clinic concept.
Yeah.
What can you explain that?
Yeah, so Easy Clinic is our branding that goes behind the services. If you say to someone, we do blood pressure, they know what it is. But if you say to someone, we can do a meds check or we can do diabetes, they don't quite know what it is. So we've branded it all as Easy Clinic because we want to make the service as easy as possible for the patient so they don't have to make an appointment. Some of the services are free, some of the other ones they do pay for. But you need to talk in patient's language or easy, simple language that people understand. That's why we called it Easy Clinic.
So easy to, like patient language, not pharmacist language, basically.
Yeah, pharmacists use technical terms because that's what they are. They're scientists and they use the correct technical terms, but sometimes patients don't understand that. And you need, by using simple terms that people understand, you need to have good communicators. So communication's a key to everything that we do. And
what sort of training do you do to get the staff and the pharmacists to understand, to adhere to that concept?
It's in everything we do. We try and say, look, keep it as simple as possible. If you don't understand, ask, because there's no such thing as a stupid question. And it goes the same with the customers. And we say to the customers, is there any questions you'd like to ask? Whether it's handing out a script or that type of thing. And by having the consult rooms, if you're sitting down doing a service, the customer's got you as a captive person and they can ask you the questions and they relax a little bit more and tell you a lot more information. And to provide that continuity with the services, we record everything because I don't want to be there 70 hours a week. I only want to work 40 hours a week. And if I do something one day and I'm not there the next day, the other pharmacists will look up what I did or what I recommended for the patient and follow up on it. Right. And patients really appreciate that.
So it's basically increasing continuity of care.
And that continuity of care is key because you want to build a relationship both on a personal and a business level with the patient. And from a business point of view, you need to provide that continuity of care. And I think it's also demonstrates a level of professionalism if you can do that continuity of care.
And when we were talking before, you mentioned that you'd owned the pharmacy since 2003.
Yeah,
I think. Yeah. And has this building up towards the professional services that you offer? Has that been ongoing since then, or?
Yeah, look, originally when I was first there, I always like doing services, and we had an office there that we used to use that we converted into a consult room, and then later on we actually put a better door in that allowed wheelchair access and things like that. And we were originally part of a banner group which we left, and we put a lot of time and effort into thinking about, we're going to be independent, what do we want to be good at? We want to be good at services. So we went round and had a look at pharmacies who had consult rooms, got some guidelines, you know, the same guidelines that the doctors use, and built consult rooms to fit that in. We also did a fair bit of work with the designer to make sure that our workflow, and when we engage with the customer to offer them services, that it worked really well.
And was there any consideration of the demographics of the town, for instance, in terms of which services you offered?
Yeah, look, we did get all the disease state demographics and look at what we needed. We also got all our loyalty club data to look at the age of the patients and the demographics of those, and we worked out which services we could deliver. And also we looked at a needs analysis for the community and looked at what gaps there were in the market, and that's why we started doing the sleep apnea one. We've tried with some other different services at times that haven't worked. We've tried to get a diabetic educator on board to use one of our rooms because where they're based in Bathurst is not easily accessible, and it's just a challenge sometimes to get other third parties to provide services.
But obviously, you know, this award is recognition of the work you've done to build up this category. I mean, it's obviously, has it been a success for the business as well?
It has, yeah. And some of our services are free for the patients, other services they pay for. And when you provide a service and it's done in a professional manner, in a professional environment, it's much easier to say to the patient, this is how much it is, and they're much more willing to pay. And even some of our free services for people that might be passing through Bathurst come in and say, can I get this done? We'll do it for them. And they say, how much do I owe you? And we say, well, actually, that's one of our free services. But they still offer to pay anyhow. So that says to me that they value what we're doing.
Yeah, absolutely. I mean, you can't get a better endorsement than that, really. No. So, and look, I've got to ask, I mean, Mount Panorama and the races, any particular stories of any patients that have come in relating to that?
Oh, look, every year we see race teams, see the drivers. I suppose the personal connection I've always had with the race is since I've been there. We've got friends who have Dick Johnson stay there every year, and Dick Johnson's birthday is actually on or around the race every year. So I've been there for a couple of years when they presented him with a birthday cake and sang happy birthday. So you get to see and meet some of the people, and I tell you what, most of the race teams and the drivers are very down-to-earth people.
And obviously the staff at the pharmacy know of the award. What was the reception?
They were very excited. And since we were announced as a finalist a while ago, we've got media screens in the pharmacy, and we've had it up there that we're a finalist for that. And we've had customers saying congratulations to us, and they have been asking in the weeks leading up till yesterday, when do you find out whether you win or not? So so they were very excited about that, and we'll obviously get that updated next week and put on saying that we won the professional services category.
Yeah, that's a fantastic endorsement of your reach into the community, really. So congratulations, Paul. And thanks very much for speaking to us. Thank you.
Thanks.
And we'll be back at APP 2015 with more from Pharmacy News later.